All right. Thank you, everyone, for joining us. Our hosts today are Arthur and Gabby from the Customer Success team at Luma Health. So over to you, team.
Awesome. Thank you, Andrella. Hi, everyone. My name is Gabby. I'm a Customer Success Manager with Luma Health. And we have Arthur. Arthur, you might be muted.
Hi guys, sorry for that. Hi, like Gabby said, my name is Arthur and I'm also a Customer Success Manager with Luma.
Awesome. Today we'll be talking about vaccine readiness and how you can use some of the current features that are already within your Luma account to navigate distributing it to your patients. If you guys have any questions, feel free to type your question in the chat icon located at the bottom of your screen, and then we can answer them along the way. And we'll also have a few minutes at the end of the call to answer any last minute questions then. So today we're going to be talking through some of these topics. So just patient education, screening and consent, appointment scheduling and demand management, vaccine appointment reminders, appointment day workflow management, post-vaccination wellness tracking, booster dose reminders, and then lastly, some pro tips about how to share COVID test results.
This slide is a visualization of how Luma Health suggests the vaccine operations solution should work. Luma suggests a 4-step pre-injection workflow, starting with educating patients, then screening and consent, scheduling their appointments, and reminding the patients of their visit. On the day of the appointment, Luma Health's virtual check-in and waiting room can also help you manage your arriving patients to avoid crowded waiting rooms. And following the first dose, we also suggest 2 more reminders to ensure patients get their second dose, as well as a post-appointment follow-up. Hi, Gabby. I believe you're muted.
We're having muting problems today, sorry. Okay, let's first talk about patient education. Sorry about that, everyone. As patients get excited and interested in the COVID-19 vaccine, you might notice a large influx of calls with questions about it, whether or not your practice is already administering it, or if you have plans to. Due to the time those calls might take up, your staff will probably find themselves to not be able to do what they do best, which is provide healthcare to those who need it. We suggest 3 different ways to handle the influx of patient interest. The first way is through outbound proactive outreach. As you can see on the first picture of this slide, we're using Luma Health Broadcast to message large groups of patients with announcements such as when you've received the delivery of the vaccine. Here's a sample broadcast message that we've put together. Hayes Valley Health Center, we are excited to announce that we have received shipments of the COVID-19 vaccine. We will reach out to you shortly to schedule your appointment. The second way to handle the influx is through outbound, proactive, and capturing outreach. As you can see in the second picture, we're using Luma Health's broadcast and custom action features to message large groups of patient populations and allow them to opt into being informed of when the vaccine will be available to them. As an example, we can set up a custom action that can be used to listen to the keyword COVID and to automatically add the patient to the wait list. Here's a sample broadcast message with the custom action built in the backend. Hello, we are excited to announce that we have received our initial shipment of the COVID-19 vaccine. If you're interested in receiving the vaccine, please reply COVID to this message. And the last way that we recommend is being reactive to inbound outreach. You can use Luma Health custom actions to set up auto replies to certain keywords. For example, this custom action searches inbound text messages for the words COVID, vaccine, Pfizer, Moderna, and by default, and automatically replies with a message that says something along the lines of, Hayes Valley Health Center, thank you for texting about the COVID vaccine. We are excited to offer the vaccine soon. However, we are currently not administering the COVID vaccine. We are waiting to receive shipments of the vaccine, and we will reach back out when we are ready to start scheduling appointments. We can also create this custom action in Spanish if you'd like, but at the moment, only Spanish and English are built out. If you'd like to deploy this custom action to your account, please open a ticket by emailing support@lumahealth.io and requesting the following custom action called COVID Vaccine Autoresponder.
In this slide, we are going to talk about the second step in your pre-injection workflow recommended by Luma. In order to ensure the correct and eligible patient population receives the vaccine and to collect any patient consent, it's important to kick off the patient's vaccination journey with screening and consent forms. You can use mobile patient intake to automate patient eligibility verification using customized self-screening surveys. Once verified, use intake forms to capture consent and collect necessary information to kickstart the patient's vaccination process. We suggest 2 forms as part of your workflow. Gabby, if you could click on the first one, please, so we could take a look at those. This is how the form will be shown to the patient, and this is how their experience will go. In this one, in order to make sure the COVID vaccine is safe for your patients to take, they should answer a few questions to ensure they are eligible and safe to take the vaccine. Thank you, Gabby. And the second one is the medical treatment agreement consent. This one, after they complete their screening checklist, patients can review a Luma form to authorize their medical treatment for the COVID vaccine, providing their name, their signature, and giving you the authorization. All this information, all these forms will be saved under the patient's profile in your Luma account for easy access of your staff. These forms can be sent after an appointment has been scheduled in the appointment reminders or to qualify or disqualify patients as part of a scheduling workflow. We have built 2 intake forms that are available to deploy in your account. And if you wish to deploy them, open a ticket with our team and request them. You can also access these forms' IDs and names at the Help Center article named Operationalizing the COVID-19 Vaccine that will be included at the end of this presentation that will be shared with you.
Awesome. To navigate appointment scheduling and demand management, we've suggested that you use Patient Scheduling Plus in 2 different ways to relieve any burden on your front office staff or call center and to provide a streamlined patient experience. The first way is to place the scheduling form on your website via a link to help patients directly schedule and avoid calling your call center. The second way is to use broadcasts to send a scheduling form to identified patient cohorts to prompt them to get scheduled for their vaccine. We recommend you template your schedule for vaccine appointment types to best support this. You can also combine this workflow with the screening and consent forms to further streamline manual staff work.
As a continued aspect of the appointment scheduling and demand management, you can use Luma Health's smart waitlist to offer available appointment slots in bulk to patients who fit the criteria. If you're ever going to be offering more than 100 waitlist offers at once, we will be soon putting a new safety measure in place that will require users to input their email before the offers are sent. The purpose of this is to prevent user error or mistakes before offers are sent to large amounts of people. In the current state, there's no stopgap to prevent accidents, if offers are sent to a large amount of patients that should not get the offer. Please note that this is not yet live, but will be released shortly. And this safeguard will only affect users sending waitlist offers to more than 100 people at a time.
For vaccine appointment reminders, we recommend using reminders and custom actions to reduce no-show rates and phone volumes, manage cancellations, and ensure patients are prepared for the appointment by including necessary special instructions. Luma provides customizable appointment reminders where we can add verbiage depending on the type of appointment, which provider will be seeing the patient, and at which location the patient will be seen at. We also have pre-built custom actions you can add to your account for additional instructions. Please feel free to reach out to your CSM for information on this. Once the patient's first dose is scheduled, we recommend using a COVID-specific reminder to instruct and remind the patient about the first dose appointment. Use this opportunity to communicate any specifics of the encounter, including reminders about any non-traditional places of care, or in other words, if it's going to be curbside, in a tent, or in a drive-through. If you want to deploy these, please open a ticket and request the COVID vaccine first dose custom action to your account. Arthur and myself will also share a handful of Help Center articles with all of our COVID-19 custom actions and their names following this call.
On the day of the appointment, we recommend using the Zero Contact Solution Suite for patient check-in. Patients will receive a text when it's time for their appointment, prompting them to reply "Arrived" when they are in the parking lot. Your staff will then have a simple work queue to manage who is inside the waiting room and who has been checked out. You can use the Zero Contact Waiting Room to move patients through the virtual waiting room with automated text instructions, or use Zero Contact Check-in to let patients know they should wait outside until otherwise told to enter the office, to ensure no one is ever left waiting too long to receive the vaccine. While patients wait in their cars for their time of services, your front office staff can send any required intake forms. We also recommend utilizing Luma's mobile patient intake tool to capture a patient's insurance information and driver's license before they come in for their vaccination. Getting this information beforehand will help to minimize physical exchange during appointments, as well as allow your patients to get the vaccine quicker. We have pre-built intake forms you can easily adopt into your workflow. Please email your customer success manager or our team to learn more about adding all these features to your account.
For post-vaccination wellness tracking, we recommend using patient screening forms and custom actions to track patient wellness following their vaccination and guide those experiencing adverse events to seek appropriate medical attention. It will be important to check on your patients after they receive the first dose of the vaccine, just in case they have any questions or need additional assistance. When you send a screening form to the patient for them to complete, the responses will be pushed into the patient's profile or within the file management section of your Luma account for your team to take action on if necessary. In addition to an intake form, you might also consider deploying a 3-day post-first dose message asking how the patient is feeling. If you'd like to deploy that, please request the custom action COVID vaccine first dose T+3 checkup to be added to your account. Here's an example of what the custom action would say. Hi patient, you recently came in for a COVID-19 vaccination. For most patients, the side effects are mild and flu-like and go away on their own in a few days. You can see more details here. We'll include a CDC link there. If you're experiencing more serious symptoms, please call, and if experiencing a medical emergency, please call 911.
On this slide, we'll go over how you can use Luma Health's custom actions to engage with patients to ensure they have scheduled their booster dose appointments, as a reminder to keep the appointment top of mind for the patient. Based on current guidance, patients are required to come back in 21 to 28 days later for their second vaccine dose. This is important since based on current data, one vaccine dose is only 60 to 70% effective. Depending on your clinical and operational flow, you may be scheduling the booster dose at the time the first one is scheduled, or you may schedule it after the patient arrives for dose 1, or maybe even after they've taken their first shot, for example, as part of an end-of-day process. Because of the large variety of operational workflows, we recommend 2 different approaches to sending the dose 2 reminder. The first one is a 7-day post-dose 1 reminder. This will be used to remind the patients to schedule their second dose, and we will let the patient know that they can ignore the message if they've already scheduled it before. We suggest this to provide good coverage of any scheduling mistakes and to also ensure no patients are lost. We suggest this custom action be triggered based on an appointment type linked to the first dose. The second approach is a 1 day prior to dose 2 reminder. This will remind the patient to arrive for their second dose on the correct date and time. We suggest the second custom action be triggered based on an appointment type linked to the second dose. If you wish to deploy these custom actions, please reach out to our team. You can also find the custom actions names and IDs in the first Help Center article linked at the end of this presentation. Luma can also automatically outreach to patients to get them rescheduled in case they cancel their appointments for their second dose. This is especially important since based on current data, like we said before, without a second dose, the whole treatment is not 100% effective. The custom action in this case will let the patient know that they missed their second dose and that they should call the practice to reschedule their appointment or schedule online.
Great. So just to review some of the ways Luma Health's vaccine operations solution system can help your team, we'll make it easier for you to make vaccine information readily available to patients through broadcast messaging, help your patients with high priority get the vaccine in a timely manner through intake forms and screening surveys, allow those patients to quickly and easily schedule their vaccination online through Patient Scheduling Plus, reduce no-shows and manual staff work by sending automated reminders for appointments and take care of backfilling any cancellations that might come up through the waitlist, get notified of when your patient has arrived, give them instructions on where to park or wait, and eliminate a packed waiting room by monitoring when patients can enter the office through zero contact solution suites, and check in on your patient wellness after their first dose through patient screening forms and remind them to schedule their next booster dose through custom actions. So now Arthur is going to go through some of the additional tips we've put together.
Thanks, Gabby. This next slide does not exactly concern vaccine readiness, but we thought it would be helpful to share with you all. We know that many practices are not yet ready to start providing the vaccine to all their patients, but they may be providing COVID tests. If that's the case, we'd like to introduce you to a new possibility within Luma. Now, you are able to use the broadcast feature to send COVID test results to your patients in bulk for both positive and negative results. The way to do this is by sending a broadcast via file upload. As seen in the slide, we have the standard CSV file headers normally required for this sort of broadcast. But to share COVID test results, you just need to add an additional column labeled COVID to include the COVID-19 test results in the messages you'll be sending out to your patients. You want to use the following squiggly: upload.covid, as you can see in the example in the screen. When the message is sent, the word that's in the column in the CSV file, either positive or negative, will be added to the message in place of the squiggly. For more information on this method, make sure to check the corresponding Help Center article also added in the next slide. As both Gabby and I have mentioned throughout the call, here are some Help Center articles, all the information and links we've gone over. We will share this deck with all of you shortly, where you can access these. You can also search for these articles and other ones in our Help Center by clicking on the question mark at the top right corner in your account, as you can see in the screenshot in this slide. The first article over there, operationalizing the COVID-19 vaccine, I would say it's the most important one for you. If you need any IDs or names for the features we went over during this call, you can access that article, again, the information from there. And for the broadcast, to share COVID results, you can see the number 4 there, how to share COVID-19 test results via broadcast. And if you still have any questions, you can always reach out to our team.
Awesome. Yep. Well, as we mentioned, the Luma Health success team, customer success team is ready to help you guys as you roll out your vaccine program. If you have time, please also visit our community center for additional ideas from other luminaries in the Luma Health community. And as always, please feel free to reach out to your customer success manager by emailing us at support@lumahealth.io or by opening a ticket directly from your account. And then I wanted to go over some of the questions that came in during the call. I'll share them here. Arthur, can you confirm that you can see the questions?
No, I can't see in your screen.
Okay, let me just share a different screen. My whole desktop. How's that?
I still can't see them. I can read them, Gabby, if you
All
want.
right. Okay, that'd be great.
Okay, so the first question we got earlier in the call was, what happens if an answer was yes to the screening questions?
And then I said, you can navigate patients to a question on the form, letting them know they're unable to come in at the moment or that they should call the office for further questions. But our forms are pretty customizable. So if you wanted to direct them to something more specific, we can definitely configure the form to do that.
And the second question we got was, can we get a copy of this recording? And of course, we'll be sharing this with you guys on the Help Center after, and you'll have access to all the links and information that are added in it.
Yeah. Did we miss any questions that anyone typed in or any last minute ones? Let's see. I don't think so.
Mm-hmm. I see that Andrella just shared here in the chat, so everyone can access. If you would like to see some sample vaccine workflows in action, you can join Luma Health's leadership team for a webinar this afternoon too. And there's a link for you to sign in the chat.
All right, everyone. Last round for questions. Oh, one just came in. Erica said, will it be possible to automatically attach the consent form to the patient's chart in our EMR? That's a great question. It's dependent on the EHR. We aren't able to push in every single thing, but if you reach out to your CSM, they would be able to let you know more of a detailed answer on what's capable and what's not with your EHR or EMR. And if anyone has advice on how they're communicating with their patients about the vaccine or COVID in general right now, feel free to share your best practices. All right, guys. Well, if there are no more questions or anything that comes up, we will send out this recording as well as the Help Center articles shortly. Windrilla, you can take it from here.
All right, thank you everyone for joining us. Like we said, feel free to join the webinar this afternoon, and we'll send you a follow-up email with all the relevant links and the recording. Thank you, Gabby and Arthur, for joining us today, and have a great day, everyone.
Thank you. Bye-bye.